Hello, everyone, and welcome to SNAP's COVID-19 office hours. My name is Miriam Carlone with Apt Associates. I'm going to spend a couple of moments going over some quick tech notes, and then we'll be able to get into the content that we have for today. So a couple of housekeeping reminders. We are recording the office hours today, as we do for each office hours, and we will post a copy of the recording along with the slides and any content that we receive through the chat box on the HUD Exchange in just a few business days. If you have any issues with audio during the webinar, we encourage you to switch over from computer to phone audio at the numbers that are up on the screen and shortly will be posted in the chat. Everyone will remain muted for the duration of the office hours this month, but we absolutely anticipate and hope to hear from you through the chat feature in WebEx. To find the chat, just take a look at the bottom right-hand corner of your screen. You should see the word chat and what looks like a message bubble. Click on that to open the chat. Please send all questions, comments, and feedback in the chat. With that, I'm going to turn things over to Karen DeBasio.
Very much, Miriam. Hello, everybody. Welcome to our December SNAP's office hours. I want to welcome you guys. Thanks for joining us this Friday afternoon. This will be the last time we see everybody or talk to everybody this year. So we're happy to have so many folks on. Just a very quick rundown of what to expect today. We have a couple of really great presentations. As you can see on the screen, we have our normal cadre of folks from the SNAP's office. On the call, you'll either hear from some of them or you will, they'll be answering a chat in the background. I think I actually forgot to introduce myself at the beginning. I'm Karen DeBlasio, Division Director in the SNAP's office. I am facilitating today for Norm. He is, has a conflict with today's meeting, so he won't be joining us, but we've got lots of other SNAP staff that you'll be hearing from. You'll also be hearing from Sarah Hicks-West, one of our TA providers, on some winter planning. And you'll be hearing from Caroline Waddell. Dr. Waddell is with the CDC, and she'll be talking to you about some of the wintertime illnesses that we're already starting to experience. Next slide, please. This is just another listing of some of the folks that join us from both from the National Healthcare for the Homeless Council and the Department of Veterans Affairs. We're always happy to have these folks joining us to do the chat and to answer questions as well. Next slide, please. So I'm going to go ahead and hand it over to Dr. Waddell from the CDC to talk to us a little bit about the respiratory disease season.
Hi, good afternoon, everyone. I work for the Centers for Disease Control and Prevention as an Epidemic Intelligence Service Officer, and bringing some information with me today about respiratory disease season and highlighting some important information about COVID-19, flu, and RSV, and how you can keep yourself and other people that you serve safe during this winter time. Next slide. I am going to give a brief snapshot of where we are right now in the viral respiratory illness season. And when I refer to respiratory illness, I'm talking about fever plus cough or sore throat. And illnesses like this that have caused people to seek healthcare are increasing around most parts of the country. And in the last 4 weeks, hospitalizations among all age groups have been increasing, and increasing by a whole lot for flu, 200% increase in hospitalizations, and then 51% increase in hospitalizations for COVID-19 and 60% increase in hospitalizations for RSV. Next slide. So RSV-associated hospitalization rates are highest among children right now, but we are seeing increases among older adults as well. And the same can be seen for influenza. And the rates of influenza are highest right now in southeast and south central areas of the country. And COVID-19 rates are highest right now in Midwest and Mid-Atlantic regions. Next slide. Looking at all of these rates combined into one map here, the dark red almost into purple and even through like dark orange colors represent high or very high respiratory illness activity. And then the green and yellow colors are on that lower end of moderate, low, or minimal activity. So the highest respiratory illness activity right now across the country is really in the southern part of the nation, the southwest, south central, and southeast parts of the United States are seeing the highest counts of respiratory illness right now. Next slide. And due to these rising rates, there was a Health Alert Network, or HAN alert, put out just yesterday, highlighting low vaccination rates for people and how that's could put people at serious risk for illness and hospitalization and potentially death. So it was just highlighting the fact that rates for vaccination for COVID-19, influenza, and RSV are pretty low right now. And the percent of deaths due to respiratory viruses is highest among adults who are 65 years and older. So I would really urge you to consider talking to people that you serve, especially residents or clients of older age, about vaccination and providing some information about how they could receive vaccine and any other potential option to increase immunization in the spaces that you work. One of those could be partnering with your local health department, seeing if they have any vaccination clinics occurring in the area that could reach people where they're at and potentially provide no-cost vaccinations. Next slide. So some of the ways that people can protect themselves from respiratory viruses are, number one, vaccines. This is the first year ever that vaccines have been available for all three of these viruses, for flu, COVID-19, and RSV. And you can locate locations that have flu and COVID-19 vaccines through vaccines.gov link. And if you're 60 years or older, you can talk to a healthcare provider about RSV vaccination as well. Next slide. And overall, there are available and effective treatments for these three viruses that can help reduce severe illness and hospitalization and death. And testing is available. Some of the different options for getting tested are through one of the websites at the bottom there, I think. But there's a program for people who either exhibiting symptoms or may have been exposed to COVID-19 and do not have health insurance. There's a program to provide testing for that. And then there's also the extended program to be able to receive up to 4 COVID-19 home tests at your address. And so there are some limitations with that, given that not everybody has a permanent address, but people in supportive housing or people in single room occupancy may be able to put their name in for that and provide an address and get some home tests provided to them through the USPS. And then if they're not able to do that, there's also the COVID-19 testing locator where people may be able to get no cost testing. And then lastly, there are the common measures that I'm sorry, I was on still going on this slide. Other tools that we know very well from the COVID-19 pandemic, like masking and physical distancing, washing hands, improving airflow in places where people live and work, all of those can still add an additional layer of protection. So we're still recommending all of those. And that's all I have for you today, but you are welcome to email with any questions to our email inbox, specialpopulations@cdc.gov. And I'm happy to take any additional questions. So stay safe out there this holiday season. Thank you so much.
Thank you so much, Caroline. That was a lot of great information and a lot of links. While Caroline was talking, there were a lot of links that were posted in the chat by Jess. So please take advantage, look through the chat. There are, again, at least 5 or 6 different links related to what Caroline was talking about. That was a lot of really great information. It impacts a lot of us and the clients that we serve. So thank you so much for sharing all of that. Going along with our winter theme, I'll hand it over to Sarah from Cloudburst, and she is going to talk a little bit about winter planning and preparation for housing and homeless programs. Sarah?
Thanks, Karen. And Caroline, you really set me up quite well here because there the slide says winter is coming, but clearly winter is here. And based on all of the information you just provided, we really need to be doing all we can to help with infection control as we have more people staying indoors over cold weather. And that clearly is adding to those concerns for where we have people experiencing homelessness congregating. Maybe those are day shelters, feeding centers, emergency shelters, and we really need to lean in with our public health partners and share our expertise around serving people experiencing homelessness, as well as with our public health partners who are the experts in infection control and disease prevention. So next slide, please. One way to prepare is, of course, to make sure that you're bringing all of your public health partners, those across your continuums of care, and individuals with lived expertise to begin planning for winter surges. Hopefully, you've already begun to do some of this planning, but it's never too late to start. This helps get everyone on the same page with consistent public messaging strategies, plans for testing and vaccinations like Caroline just went over, and then preparation for congregate or encampment outbreaks. So it's a great time to review your policies and protocols, including those emergency communication plans that you might have, if hoteling is an option for isolation, and what protocols you might need to have in place for this to occur. There's a whole bunch of great resources on the HUD Exchange, and I'm going to highlight a whole bunch of those throughout this presentation, but one in particular, Heather just dropped the link in the chat for us, is the product around forming an emergency response committee of the COC. This is a multidisciplinary team that works together throughout the year to prepare and plan for public health and natural disasters. And this is kind of a great spot for winter planning to be addressed. Next slide, please. So again, there's lots and lots of resources on the HUD Exchange. I'm going to highlight a number of these, and then at the end, we'll give you a whole bunch of links to some others. But one in particular that focuses on surge management. And so we want to encourage communities to adopt a contingency planning approach to winter planning. So that would be versatile strategies that can adapt based on your local conditions, varying inequities that you might find in your own systems and communities, and then escalating levels of shelter based on need through the winter. So surge management planning will be more fruitful and better resourced if it's in coordination with your community public health partners. Next slide, please. So this shows this the product. So the last slide was just kind of your day-to-day planning process. This is kind of that Plan B marginal surge considerations for congregate settings. And so each community is going to be different. You're going to have different resources that you can apply. But the idea for any of those plans is to be prepared for contingencies. So you can see from this slide, and then the next one is what those kind of considerations are going to be for staffing and transportation needs, facility changes, and supplies along with community partners. So we also put out guidance, and that was definitely in consultation with CDC and local health partners and Healthcare for the Homeless about sheltering in place if a substantial surge occurs. So I'll send you a link to that as well in a minute. But we really recommend that you stay in close collaboration with public health so that you can handle those situations as they occur. Next slide. So late last year and early this year, we worked to develop 5 short training modules. So I'm going to walk through a couple of those here to help you with planning and preparing for winter infection control. Each module recording is on the HUD Exchange. It's got the PowerPoint slides and the transcript. So however you choose to learn, it should be there for you. The longest one is 13 minutes, so it's not should not take substantial time for you to be able to receive some of this information. They're a great resource that you can use for shelter staff training or onboarding new staff. Heather just dropped the link for the series here. The first module is around teaching the basics about infection control measures so you can mitigate the spread of contagious viruses. So COVID, flu, Mpox, RSV, those respiratory viruses, specifically flu, RSV, and COVID, can spread quickly. And without those kind of infection prevention and control measures in place, you can really have an outbreak that needs a lot more additional attention. Next slide. So module two will help with the shelters and housing programs and your COC-led agencies develop effective communication strategies so you can keep your staff and your residents safe. So it includes onboarding information and messaging for residents, as well as how to access awareness materials and collaborate with your public health organizations. Module 3 is focusing on the basics of PPE, cleaning and disinfection, and how to prepare facilities for the upcoming fall winter time to mitigate that spread of infectious disease. This really helps with COCs and shelter leadership and our shelter staff to design their plans and update their policies and procedures as you might need to. Next slide. And then the goal of Module 4 focuses on isolation and operational considerations in congregate settings. So those might be emergency shelters. It really focuses on isolation in place and cohorting as strategies that they review. And then the final module, Video 5, is focusing on isolation and operational considerations for non-congregate settings, so hotels and dormitories. You might look partnerships, physical attributes of the non-congregate spaces, and staffing considerations are really reviewed in that video. Next slide. So as I said, there's a whole host of resources available on the HUD Exchange and the CDC website. There are winter planning templates, the resource I talked about forming an emergency response committee. And so Heather is posting some of those links in the chat right now. And those links are also available in each of those winter planning video modules as well. So we happy to answer any additional questions. Otherwise, I'll turn it back over to you, Karen.
Thank you so much, Sarah. I do not see any questions in the chat. This is a lot of amazing information. And one person actually did ask a question if all of the modules that you were going over were available at that one link, and yes, they are. So please take some time to go online. This is all really important stuff, as we all know, dealing with the health of our clients, especially during this time of year when there are so many different things going around, is really important. And I thank everybody who put a lot of time and effort into making all of these resources, both on the HUD side and our TA providers and the CDC as well. So this is some really great stuff. So thank you, Sarah, for going over all of that today with us. So next I want to turn it over to William Snow. He's a senior SNAP specialist here in the SNAPS office, and he's going to talk to everybody about the upcoming 2024 point in time count. William?
All right, thanks, Karen. This is a very timely discussion, given that just a few hours ago, we announced the 2023 point in time counts. I'd encourage you to look at that announcement. Just the very high overview of that is that there were large increases this year. It was one of those years where we saw all the effort that communities were doing, and then we saw the data and it was kind of a downer. So we know all the effort that you guys are doing at the community side, a lot of great progress happening, and yet at the same time, the factors of inflow are so high, specifically due to housing markets in particular. We know we have a lack of affordable housing. We have huge rises in rent over the last 2 years, and actually there's been a steady, strong upward trend for years. So just putting that out there, encouraging you to take a peek at those results, and we will be talking about them over the course of the next year or so as we continue to look for solutions. Next slide, please. 2024 is right around the corner. That counting will happen beginning in about a month. So just as a reminder for folks, the point in time count provides a snapshot at a single point in time of the number of people experiencing homelessness and their characteristics. Communities are required to count both a sheltered and unsheltered count at least every other year. This is a unique data collection point. We don't have unsheltered data across the country in any other form. So we know the PID count is a lot of effort. It takes a lot of resources, but it yields a high result. And the actually shown partly in our announcement earlier this year of the unsheltered and rural NOFO. Part of that is a product of seeing trends in unsheltered homelessness rise and needing a response. But we wouldn't know that if we didn't have the point in time count. So it is impactful. Your work does not go unnoticed. We really appreciate it. This count happens in the last 10 days of January each year, except for those few who get exceptions to count a little bit later. Next slide, please. So we have a few changes this year. These changes track to the updates in the FY 2024 HMIS or Homeless Management Information System data standards updates. I think the thing to highlight here is these can appear to be relatively simple on paper, but they really reflect a heavy involvement from people with lived expertise this year. Kudos to them. We are so grateful for the input we received. We feel like we have a better data collection point as a result. So really want to put a high like remembrance of the work that they have done and hope to continue a partnership like this going forward. So we specifically addressed some of our demographic elements with people with lived expertise. And as a result, a few things happened. Here, as you see on the race and ethnicity screen, we combined the race and ethnicity data elements. So it is now one element. Folks can continue to respond to all that apply. So they can respond for more than one identity. They can choose to only select Hispanic, Latina, Latino, and Latin. That's an option. They don't have to select a race in addition to that. I know there's been an interest in that, not only from HUD, but also on the census side. So we're excited to see that. And we added a new category for Middle Eastern or North African. Also something that's been asked for a long time, and we've finally been able to implement that. So very excited about that change. Next slide, please. There were updates to the gender element as well. Some critical updates that really reflect the fact that this is a gender element. For instance, the wording changed from female to woman or girl of child, and male changed to man or boy of child. Again, that's a recognition that female and male are actually sex-oriented terms or biological sex, and we're talking about gender. That's what we're collecting in this process. So there are changes that, again, may seem subtle, but actually are representative of the people that we're serving, and we're very happy to implement them. There were other elements added or other response options added culturally specific identity. We see this with our Native American partners in particular, but others as well. And we added a different identity, recognizing that we are just not going to properly identify all of the options in terms of how people choose to identify. So we added a different identity option so people can select that as they feel that's appropriate for them. Again, very happy about this. We feel like this is reflective of those that we're serving, and strongly encourage you to actually work with people with lived expertise to implement this. We just provide you elements, but I would work with folks on the ground to see what it means to develop a question around this in the appropriate way to, again, ask this in the context of the PIT count and actually other data collection. Next slide, please. We also had some updates to the housing inventory count as a result of the changes to the data standards, some new funding sources, not surprising there, right? We released the unsheltered NOFO, or unsheltered and rural NOFO, so there are some opportunities to reflect that here. We made some updates to clarify that, just like with HUD-VASH, we expect communities to reflect their stability vouchers as part of their HMIS bed coverage. So we will be asking that just like we do every other inventory, but we'll have the expectation that that's included as part of your HMIS bed coverage, just because it's an important part of your larger system. We're also not working in the same type of crunch emergency environment like we were with EHV. And the last thing is, as we're updating everything tied to our comparable databases and our efforts with victim service providers, we recognized last year that we needed to expand what we were asking when we were asking about, are you a victim service provider? That's now expanded to include, are you a victim service provider or another agency that's otherwise prohibited by VAWA from entering data into HMIS. So that's more expansive than VSPs. And this tracks closely again with the comparable database decision tree that we have published in the past, and that actually is referenced in this notice as well. Next slide, please. So I mentioned the notice. The very first item here in this list of resources is to our HUD.gov page. The first resource is the PIT count notice. You should definitely read that, get more details in terms of what the changes are. There are several other resources here. We know a lot of folks are doing this for the first time. There's a lot of turnover. Please reference those resources. There's all sorts of things. The methodology guide is just that, covers methodology, but there are many resources to help you implement your count in a safe and effective way. And we hope that it is able to answer your questions, provide you what you need so that you can successfully go out and count in a month from now. If you have questions, if there are technical questions, right, like how do I submit this in HDX, that goes to the AAQ. If there are policy questions like, am I allowed to implement this kind of methodology? Or I have this type of model that we're providing that's funded by the state. I'm not exactly sure how to put that in my data. Can you help me understand the factors to consider? That's a good one to send to the other email address there, the HICPITCount@HUD.gov email box. Again, really appreciate everyone's work. The PIT count's a big lift, but it actually has a big impact as well. And we're grateful for all that you guys do on your end. And with that, I will turn it back over to Karen.
Thank you so much, William. Again, a lot of really good information, lots of links in the slides. If you go to the HUD Exchange, there's a lot of great information on the PIT count. As William said, if you're new to this, we know that there's a lot of turnover oftentimes in our with a lot of our programs. Please take advantage of the resources that are available. This is, again, very, very important that folks participate in this. It does help us to be able to, provide information for budgets and for, to make policy decisions. So again, it's really important that we get good data from folks starting next month when people start counting folks. So thank you again, William. Our final presentation today is just a little bit of information, some updates in our HUD zone, or our HUD announcement zone, on Emergency Solutions Grants CARES Act, or CV, sorry. And I'm going to hand it over to Sharon Price Singer.
Hey everyone. Happy Friday, and glad we have a short presentation today. This is really just a quick check-in, a status update that we always share. I think we didn't get to present on last month's, but things are moving along. We have only, less than 6% left to draw from our funds. So we are reinforcing that the 12/31 deadline for HMIS and admin funds is coming up in very quickly. So if you want to go to the next slide. We are just, there are a few folks that we're concerned about. We know that most grantees are on track, and we have a few stragglers that we've been reaching out to regularly. So if you're on now or listening to the recording, please take action to get your quarterly reports in and to make sure that you are as fully spent as you are able to be. So as I mentioned, if you want to go to the next slide. Our next deadline is coming up at the end of December. So this is the HMIS and admin funds needed for closeout. If you have any ongoing questions, hopefully you know where to reach out by now, but you can reach out to your CARES Act desk officer or to your regional TA provider. For those who have reallocated funds, they have until June 30th to spend just the additional funds that were reallocated, not the initial round 1 and 2 funds. As you can also see, the draw deadline is April 30th, so you have time to complete your books. We are here if you have questions or concerns, and hopefully for most folks, we're getting ready for the closeout. And I'm not going to spend too much time on this, but I just wanted to have, for the next 2 slides, it talks about closeout. If you go to the next slide, you can see where our resources are. There are to-do lists, checklists. There are 2 webinars for you to watch about the closeout process, as well as closing out in Sage. And just making sure that once you undertake that process, that you are 100% drawn, 100% spent, and that everything is lined up perfectly. So there is not a rush to do that. So we want to make sure that everybody is prepared for undertaking that process before they begin. And that is all I have right now. The next list is just talking about when a grant is ready for closeout. So please keep all these things in mind. Reach out to your CARES Act desk officer if you need anything, and good luck with these last few deadlines. Karen, back to you.
All right. Thank you, Sharon. So that is all that we have today. This was a pretty short presentation. I think the last couple of slides are just some links to new resources that have recently been posted and some key websites. So I just want to, I'm going to scan the chat again really quickly. And there was one question in here about if you are having difficulties meeting some of the reporting deadlines. We are communicating with, we know that some communities have been impacted by some challenges with getting reports done on time, and we are dealing with those communities. We are communicating with them individually. So you should receive an email today from HUD, from hmis@hud.gov, from that email box. But I don't see any other questions, so I want to go ahead and just, again, thank everybody. This is a really busy time of year for folks that are working in our field, we know, and we appreciate you guys all year round, but especially this time of year. We hope that you all are able to take some time and enjoy family, friends, good food, whatever it is you like to enjoy this time of year. Please take some time for yourselves, and we just know how greatly and deeply HUD and SNAPS appreciates everything that you all do. Happy holidays to everybody, and we will talk to you again in January. Thanks, everyone.